Unlocking Minds, the Power of Personality Tests. Welcome back to the show, everybody. Today, we're diving deep into the world of personality, the very essence of who you are. We're talking about the tools that experts, folks like me, use to unlock the secrets of the mind. We're going to break down 7 key personality assessment tools used in clinical psychology. These aren't just some internet quizzes you find on social media, no sir. These are the real deal, used by professionals to understand what makes you, you. These tools are essential for diagnosis, treatment planning, and figuring out if the treatment is even working. So buckle up because we're about to unlock some serious knowledge about the power of personality tests. Now let's talk about anxiety. We all feel it sometimes, right? It's that knot in your stomach before a big presentation, that restlessness that keeps you up at night. But how do you know when it crosses the line from everyday worry to something more serious? That's where the Beck's Anxiety Inventory, or BAI, comes in. This tool is like a measuring stick for anxiety. It's a straightforward questionnaire, 21 questions to be exact, each one asking about a specific symptom of anxiety. You rate each symptom on a scale of 0 to 3, with 0 being not at all and 3 being severe. The beauty of the BAI is its simplicity. It's quick, easy to understand, and gets right to the heart of the problem. The BAI helps us figure out how severe your anxiety is. Are you dealing with mild jitters, moderate uneasiness, or are you crippled by intense fear? This information is crucial because it allows us to tailor a treatment plan specifically for you. Maybe you need some breathing exercises to calm those nerves, or perhaps therapy is the answer. Whatever the solution, the BAI helps us get you there faster. We've talked about anxiety, but now let's address the elephant in the room, the silent tormentor that affects millions: depression. This isn't just feeling blue or having a bad day. Depression is a serious condition that can cast a shadow over every aspect of your life. Now, just like with the BAI, we have a tool to measure the severity of depression, and it's called the Beck's Depression Inventory, or BDI. This questionnaire digs deep into the symptoms of depression, helping us separate the blues from something more serious. The BDI is a 21-item questionnaire, and each item describes a symptom of depression. We're talking about feeling sad, hopeless, losing interest in things you used to enjoy, even changes in your appetite or sleep. Again, you rate each symptom on a scale of 0 to 3, with 0 being not at all and 3 being severe. It not only tells us how severe your depression is, but it also helps us differentiate it from other mental health conditions. The BDI allows us to track your progress over time. Remember, you don't have to suffer in silence. Depression is treatable, and the BDI is one of the tools that can help you find your way back to the light. Now, we've talked about anxiety and depression, but the human mind is a complex thing, isn't it? There's a whole spectrum of mental health conditions out there, and sometimes we need a more comprehensive assessment to get the full picture. That's where the Brief Psychiatric Rating Scale, or BPRS, comes in. Think of the BPRS as a broad stroke painting of your mental state. It covers a wide range of psychiatric symptoms, not just anxiety or depression. We're talking about things like hallucinations, unusual thought content, emotional withdrawal, even things like hostility or grandiosity. Unlike the BII and BDI, which you fill out yourself, the BPRS is administered by a trained clinician, someone like me, who observes your behavior and asks you targeted questions. It's a more in-depth approach, and it provides valuable information about the severity and nature of your symptoms. The BPRS uses a semi-structured interview format, which means we have a set of standard questions, but we can also ask follow-up questions to get a clearer understanding of your individual experience. This tool is particularly useful in clinical settings where we need to track changes in your symptoms over time. The BPRS helps us stay one step ahead, ensuring that you're getting the best possible care. We've talked about assessing specific symptoms, but what about getting a deeper understanding of your personality as a whole? How do your personality traits interact with potential mental health concerns? That's where the Millon Clinical Multiaxial Inventory, or MCMI, comes in. This tool is like a deep dive into your personality, exploring both your strengths and weaknesses. It helps us understand the underlying patterns of thinking, feeling, and behaving that make you who you are. The MCMI is a self-report questionnaire, meaning you answer a series of true or false questions about yourself. But don't let that fool you. This isn't some simple personality quiz you find online. The MCMI is a sophisticated tool that measures a wide range of personality styles and clinical syndromes. The MCMI helps us identify these vulnerabilities and tailor treatment accordingly. But it's not just about pathology. The MCMI also helps us understand your strengths, your coping mechanisms, and your overall approach to life. This information is invaluable in therapy, allowing us to develop a treatment plan that aligns with your unique personality style. We've talked about the MCMI, but let's dive into another fascinating tool that explores personality. Eysenck's Personality Questionnaire, or EPQ. Now, this questionnaire is based on the idea that our personalities are shaped by three fundamental dimensions: extroversion, neuroticism, and psychoticism. Extroversion is all about how outgoing and sociable you are. Neuroticism refers to your emotional stability. And then there's psychoticism, which doesn't necessarily mean you're, well, psychotic. It's more about your tendency toward tough-mindedness versus tender-mindedness. The EPQ uses a series of yes-no questions to figure out where you fall on each of these dimensions. It's like plotting your personality on a map, giving us a visual representation of your unique traits. The EPQ helps us understand these nuances, providing valuable insights into your strengths, weaknesses, and potential vulnerabilities. This information can be incredibly helpful in therapy, allowing us to tailor our approach based on your unique personality profile. We've covered a lot of ground, but now it's time to talk about the granddaddy of personality tests, the one that's been around for decades and is still widely used today, the Minnesota Multiphasic Personality Inventory, or MMPI. Now, this test is comprehensive, folks. We're talking over 500 true-false questions that cover a wide range of topics, from your physical health to your relationships, your beliefs, and of course, your personality. The MMPI was originally designed to identify mental health disorders, and it's still used for that purpose today. But it's also become a valuable tool for understanding personality in general. The MMPI doesn't just look at individual traits in isolation. It examines patterns of responses, looking for subtle clues that might reveal underlying psychological issues. The MMPI is known for its validity scales, which are designed to detect if you're trying to present yourself in a favorable or unfavorable light. The information gathered from the MMPI is invaluable in clinical settings, helping us make accurate diagnoses, develop effective treatment plans, and monitor your progress over time. It's a powerful tool, but it's important to remember that it's just that, a tool. We've explored a range of personality assessments, and now it's time for our final stop on this journey, the Multidimensional Personality Questionnaire, or MPQ. Now, this questionnaire is all about understanding your personality traits in a multidimensional way. Instead of just focusing on broad categories like extroversion or neuroticism, the MPQ breaks down personality into a wider range of dimensions, each one representing a specific aspect of your personality. The MPQ helps us understand the specific ingredients that make up your personality, providing valuable insights into your strengths, weaknesses, and potential vulnerabilities. This information can be incredibly helpful in therapy, allowing us to tailor our approach based on your unique personality profile. For example, if you're high in positive emotionality, you might respond well to therapies that focus on building resilience and cultivating optimism. But if you're high in negative emotionality, we might explore coping mechanisms for managing stress and anxiety. The MPQ is like having a detailed map of your personality, highlighting the peaks and valleys, the winding roads and scenic overlooks. Well, folks, we've covered a lot of ground today, haven't we? We've explored 7 powerful personality assessment tools used by professionals to unlock the secrets of the mind. From the BII, which measures anxiety, to the MMPI, the granddaddy of personality tests, we've delved into the fascinating world of personality and its impact on our lives. Remember, these tools are just that, tools. They're meant to be used by trained professionals to gain a deeper understanding of who you are and what makes you tick. Understanding your personality is like having a superpower. It gives you the knowledge you need to make informed decisions about your life, your relationships, and your overall well-being. If you found this video insightful and want to keep exploring the fascinating world of psychology, don't forget to hit that subscribe button. And to make sure you never miss out on our latest deep dives into the mind, tap the bell icon to get notified instantly. Together, let's continue unraveling the mysteries of the brain and mental well-being. And hey, If you enjoyed this, give it a thumbs up and share it with someone who might benefit from it. Thanks for watching and see you in the next one.